Okay, Daphne, the first structure I need you to find on your patient is the lumbosacral junction.
If I could have you just face down right here on the table.
Follow the patella down to the apex side.
Starts now.
Tibias.
I'm just going to do here, and you're going to tuck your britches in, right here, and roll your britches down just a little bit. And from here, I'm going to windshield wiper down to find the top of the iliac crest. And once I locate the top of the iliac crest, I'm going to windshield wiper down again. So I knife down the top of the iliac crest. I'm going to windshield wiper down to the posterior or the interior aspects of the PSIS. And from there, with my superior hand, I'm going to go just bisect that medially. And then medially,
To
from
what
right
structure?
there, I'm on the S2 tubercle. And from there, I'm going to go cephalically up and feel for soft tissue. So I feel bony resistance, and I've located soft tissue. And to confirm the lumbosacral junction, I'm going to move from the PSIS on my superior hand, on my inferior hand, just a little medial onto the sacrum and move cephalically again. I'm going to feel for soft tissue, and I feel soft tissue, and so I've located the lumbosacral junction.
Okay, using a landmark, palpate the right transverse process of T4.
All right, so I'm going to have my patient move both his
So
arms.
using a landmark, palpate the right transverse process of T4.
And I'm going to find the inferior border of the scapula. And I've located the inferior border of the scapula, and I know that bisect to that, if I bisect right to that, I'm on the spinous process of T6. And I'm going to have my patient move his hands back. And I know I'm on the spinous process of T6, so I'm going to move up to T4, T5, T4. I'm on T4, and from T4, I'm going to go up one spinous process. And from one spinous process, I'm going to go lateral an inch, take out tissue stack, put my episternal notch right over that. And I'm going to wag, and I feel the wag, and I've located the transverse process of the right transverse process of T4.
Okay. Next, since the patient's in this position, I'm going to have you go ahead and find the navicular bone in the foot on the right foot.
All right.
So right navicular bone.
All right. If you could just flip on your back.
So the patient's right navicular bone.
All right. So I'm going to the right navicular bone. I'm going to stabilize the foot. The heel. I'm going to cup the heel of his foot with my medial hand, and I'm going to find the medial with my lateral hand. I'm going to stabilize the foot and find the medial malleolus and just go a little distal to that, and I'm on the body of the talus. I'm going to follow the talus up to the dome of the talus, and from the dome, I'm just going to go a little distal to that, and that is a navicular bone. To confirm, I'm going to find the highest point of the arch, line it up with my thumb, and I'm going to pinch the navicular, stabilize with my lateral hand the talus, and I'm going to palpate the navicular bone, and I've located the right navicular bone.
Okay, next, palpate the left articular process of C4.
All right.
Left
so
articular process of C4.
if I can have you sit up and just sit at the end of the table, the left articular process of C4.
Right.
So I'm just going to have my patient lean his head forward and just rest your head on my sif and if right here, or my thumb in my sif and if, and I'm going to find the EOP. And from there, I'm going to find the spinous process of C2. And then from C2, I'm going to count down to C3, and then C4. And then C4, spinous process, I'm going to wrap around 3/4 of an inch to an inch, take out tissue, and go put my fingers right where the tissue was. And I feel bony resistance, so I've located the articular process of the left articular process of C4.
Okay, your last structure is the left sternoclavicular joint.
All right, so
Left
the left sternoclavicular joint. I'm going to, with my, if I could have you just turn and face that way, thank you. I'm going to, with my lateral medial hand, I'm going to sternoclavicular joint. I'm going to put my if on the clavicle and my sif on the episternal notch. And to confirm the sternoclavicular joint, I'm going to grab with my lateral hand the arm, and I'm going to move the arm passively superior and inferior. And I feel movement in the sternoclavicular joint, and I've located the sternoclavicular joint.
You are done.